Hi, and welcome to the annual staff health training. Since this is a virtual training, please do not hesitate to stop into my office, call, or email me with any questions. Welcome back to a rather unconventional start to the new school year. I have the utmost confidence in the safety measures that have been put in place, but it is always important to engage and encourage everyone in the school and the community to practice preventative behaviors. These are the most important actions that will support schools' safe reopening and help them stay open. This video will discuss the new COVID-19 guidelines, how to recognize a medical emergency, and how to obtain help when needed. Reminder, any staff injuries must be reported to the nurse and principal. If an injury occurs when a nurse is not present, please call Care at 1-800-425-3222. Even if you feel the injury doesn't require a call to Care, it is always best to report work-related injuries. One of the most important things that you can do to prevent the spread of infection is number 1, wash your hands. Number 2, keep your hands away from your face. And number 3, use a hand sanitizer when the sink is not readily available. The use of masks has increased the incidence of individuals touching their faces. So please make sure your hands are clean when donning or doffing your mask. And once on, try to avoid fixing or adjusting your mask unless your hands are clean. Make sure the mask covers your mouth, nose, and chin. And reusable masks should be washed after each use. Disposable ones should be thrown away after one day or when soiled. Since classroom teachers spend continuous hours a day with their students, they are often in an excellent position to detect early physical and behavioral changes in students who are ill at school. Teachers may observe differences in the usual pattern for a particular student. The physical and behavioral indicators listed on this slide are nonspecific and do not in themselves suggest the presence of an infection. A pasty pale appearance may signal an illness, especially if it is a change from a student's normal skin color, as can a flushed appearance with rosy cheeks or glassy or red eyes. Persistent coughs, especially with other symptoms such as episodes of coughing followed by gagging or a whooping sound, vomiting, fever, loss of appetite, or weight loss, need medical evaluation. If you have any concerns, please call the health office and then send the student for assessment. Health office guidelines. For minor injuries, each staff member will be supplied with Band-Aids, wipes, and individual lip balm so that certain things can be treated in the classroom. Please call the health office first before sending a student. If there is no answer in the health office, call the main office and they will radio for the nurse. Do not send students to the main office. Symptom screenings will identify only that a person may have an illness, not that the illness is COVID-19. Many of the symptoms of COVID-19 are also common in other childhood illnesses, like the common cold, the flu, or seasonal allergies. This slide is to provide you with some guidelines for how to identify a student who needs to be assessed by the health office. Oftentimes, students have coughs because of postnasal drip, allergies, or even after an upper respiratory infection. A cough is also a common symptom of viral respiratory infections. Usually, this cough goes away shortly after you've recovered from the infection. But in some cases, your cough might stick around long after you've healed. A cough that lasts longer than 3 weeks after a viral respiratory infection is called a post-viral or post-infectious cough. No detected active viruses on nasal swabs of COVID patients have been detected by day 10. This means that by day 10, there has been no virus capable of causing illness to others. The CDC guidelines for isolation versus quarantine. To isolate an individual means keeping those with illness away from others. To quarantine means keeping those who may have been exposed away from others. A COVID exposure is considered if there is greater than 10-minute contact with a known case. The CDC guidelines on when and how to isolate are listed on this slide. Please be aware that we will rely on our local health department to determine when individuals need to isolate or quarantine. Also, please keep in mind, if you are asked to quarantine because you have had contact with a sick individual, you will only be informed that you have been exposed to a patient with the infection. You are not told the identity of the patient who may have exposed you. Student conditions can be found in Genesis. Click on the first aid sign near the student's name. and it would lead you to a slide that gives you information on what the student's medical condition is. Your nurse will reach out to you with any specific emergency health plans. Your medical response team should be called anytime you are unsure about a student's medical condition in the classroom. They may have collapsed or unconscious, have a serious injury, a seizure, bleeding that you cannot control, difficulty breathing, or a severe allergic reaction. When in doubt, call the MERT. Dial 104 star 01 from your classroom phone to call the MERT. This will lead you to the overhead announcement, and you can call them directly to your room. Asthma is a long-term chronic lung disease that occurs when lung tissue becomes irritated and produces mucus and a cough. This irritation causes the airways to become swollen, resulting in a decreased flow of air. Asthma can be minor or it can interfere with daily activities. In some cases, it can lead to a life-threatening attack. It can cause difficulty breathing, chest pain, cough, and wheezing. The symptoms sometimes flare up. Please contact the health office for any student experiencing an asthma attack and ask the student if they have their rescue inhaler on them. Remember, all student health information can be found in Genesis under the first aid cross. An asthmatic emergency can occur quickly if a student does not have access to their rescue medication. If a student begins to display signs of an asthma emergency, contact the MERT immediately. Asthma symptoms can occur quickly, so please, if a student is having an asthma attack while you are waiting for the nurse or the MERT team, or for reassurance, limit movement of the student, have them sit upright, and do not leave them alone. If they have their rescue inhaler, have them take 2 puffs. Asthma symptoms are often very predictable and tend to occur more in the fall or spring at peak allergy season. Viral upper respiratory infections can also trigger inflammation in the lower airways, resulting in an asthma attack. Avoiding asthma triggers is the first level in the care of an asthmatic patient. These classroom tips can help to prevent an asthma attack in students. Please only use cleaning products that are district approved. Each classroom has a cleaning station located within the room. Please only use district approved supplies. Diabetes. There are 2 types of diabetes, type 1 and type 2. The type that we commonly see in children and adolescents is type 1. These students need insulin daily for life. One of the side effects of insulin is hypoglycemia, which is indicated by a low blood sugar. A diabetic with severe hypoglycemia may experience a medical emergency, including fainting, seizures, or loss of consciousness. It is important to give carbohydrates before the blood glucose becomes dangerously low. If you see a student experiencing any of these symptoms of hypoglycemia, please provide them with 15 grams of carbohydrates. You will be told what the student can have to help raise their blood sugar should you have a diabetic student in your classroom. This will be in the student's health care plan. Some examples of 15 grams of carbohydrates are a half a bagel, 15 grapes, a small apple, a banana, or an orange. Your diabetic student will carry their 15 grams of carbohydrates for emergencies with them at all times. Seizures. Report any seizure activity to your nurse and call the nurse or medical response team for any generalized seizure. A seizure does not have to be a generalized whole body seizure. It can also be evidenced by blinking, staring off, eyes rolling back, one arm twitching, one leg twitching. Seizure first aid. Should your student have a generalized seizure, stay with them, time the seizure if you can, protect the student from injury, and remove other students from the classroom. Loosen anything tight around the neck. Never restrain or put anything in the mouth of a person having a seizure. Once the seizure subsides, roll the person on his or her side. Talk to the patient reassuringly. School nurses have been mandated to provide EpiPen training annually to school personnel in the event of a life-threatening emergency. Trained staff will be referred to as designees or delegates. Life-threatening allergies can occur from common foods such as nuts, dairy, eggs, fish, and soy. Bees and medications can also cause serious reactions. All school-sponsored activities such as athletics, after-school activities, field trips, require that any student that has a life-threatening allergy that requires the use of an EpiPen have a delegate present to assist them in the administration of the epinephrine if needed. All staff members should be aware of students under their supervision who may require administration of an EpiPen. Make sure substitutes are also aware of students with allergies and are prepared to take action. Signs of anaphylaxis could be initial signs would be hives, tingling mouth, swelling of lips, face, and eyes, vomiting. As the reaction continues, swelling of the tongue, swelling, tightness in the throat, wheeze, or persistent cough may begin. Epinephrine must be administered immediately. The administration of the auto-injector is very user-friendly. And if the student cannot self-administer the epinephrine auto-injector, you will reassure them, have them lie down, and you yourself take a few deep breaths. Please be sure to delegate someone to call 911 should you need to administer an epinephrine auto-injector. Students must go to the ER after administration of epinephrine. Types of epinephrine auto-injectors are ordered based on an individual's weight. Once injected, the medication will only last for 15 minutes in the system. Calling 911 is imperative. Administration of the epinephrine auto-injector is to remove the cap and firmly press it against the outer thigh. You will hear a click. Hold in place for 5 seconds. The AviQ auto-injector has recorded directions which will guide you in how to administer it. Same principle is to hold it against the outer thigh, press firmly, and hold for 5 seconds. Massage the injection site for 5 seconds as well. Monitor the student. It is best always to have them lay down and raise their feet and legs, and they must be transported to the hospital. You can dispose of the injector in the nurse's office or to EMS personnel. Why become a designee? To hopefully save a life. Bloodborne pathogens. Please treat all blood or body fluids as if they are known to be infectious. Use gloves and or masks. If it's wet and it's not yours, don't touch it. This is the proper procedure for how to take off your gloves without getting any contagious material onto your hands. If you have a potential contamination, you are to wash the affected area with soap and water for at least 15 to 20 seconds and make your nurse aware. If it's in your eyes, rinse your eyes for 5 minutes. Anytime you remove gloves, you should wash your hands. If you have a body fluid mess, your custodian knows best. Contact your custodian. Don't try to do it yourself. Please check with your physician regarding vaccines for your health. A pneumococcal pneumonia vaccine is generally given at age 65 or older, unless you have an underlying health condition such as a cochlear implant, a valve transplant, asthma, COPD. If you are a smoker, you should talk to your physician about receiving this vaccine earlier. The Shingrix vaccine can be given at age 50 and is recommended. The TD vaccine is a tetanus vaccine, and it's good for 10 years. If you have not had a vaccine for tetanus within 10 years, you should get another TD vaccine. The flu clinic this year will be held at individual schools. Hepatitis B is another recommended vaccine for those who have potential bloodborne pathogen exposure at work. We are your school nurses. Please reach out at any time. And thank you. Teachers are some of our most important leaders. Thank you for being there for our students.